Hi everyone, welcome to Wednesday night. We are here and it's My Baby Experts and I am Shari Criso and so excited to be back with all of you. I hope you all had a wonderful, wonderful holiday last week with your families and your babies. It's been a little while since we've been on. It's been like 2 weeks since I've seen all of you, so I'm pretty excited to be back with you guys again tonight. And boy, do we have a fantastic show for you. Obviously, you can see I'm sitting here with some wonderful guests, which I'm going to introduce in just one moment. But let me get a chance to get into the chat room and just see everybody jumping in. We sent out a reminder, so I think everyone's going to start jumping in here. Hold on one second. There they are. Hi, lovely ladies. Hi, everyone. Yeah, okay, so great. So we have so much to talk about tonight, and the topic is just one that I am so happy to be able to bring to all of you because it's something that I've been using myself and also working with my patients for years and years, helping them to use something a little bit more natural, a little bit safer in many ways, whether it's for their pregnancy, for breastfeeding, for their babies and children, and it really works for everything. So the topic is homeopathy. I'm just going to have Joe come back for a second because my stream went down here. All right. So, Facebook gets a little funny. We were like down to the wire here and, it's technology. So I always complain about technology, but then I think if it wasn't for technology, we wouldn't be able to do this at all. So we can't really curse the technology. We just kind of have to accept it and work with it. It's pretty amazing and cool that we can be here and do this all over the world. We have people jumping in and literally from everywhere. And as we're about to do our introductions, I want you to introduce yourself here. Tell us where you're from, where you're watching from tonight. We literally have people from all over the world, and things have been jumping on the page. We're up to over 100,000 followers now on Facebook, and there are literally families from all over the world watching. So I want to know where you're from. Go ahead and post it right into the chat. And I see some of my favorite people jumping in here. Okay, so first of all, you're not seeing double tonight because we were laughing. The four of us were laughing and chuckling about this before we went on. We said, wow, we look like two copied images, blondes and brunettes tonight. You get blondes and brunettes, okay? But I want to just introduce who I have sitting here with me, some really special guests. Well, first of all, I'm going to introduce, if you think you're seeing double here, this is my sister, Amy, okay? And some of you might remember Amy from a few years ago. We did a show together on homeopathy. And she's back. And so this is Amy, and she's a registered nurse, and she's also a board-certified homeopath that works with families and children and pretty much everybody. We'll let you talk about it. And everyone in between. Right. And then here on the screen, we have Rachel Roberts, and she is a board-certified homeopath as well. She's from the UK. She's the chief executive of the Homeopathy Research Institute in the UK. And then sitting to her, I don't know if it's her left or her right on screen here, is as Laurel Chiten, and she is the director and producer of a new film called Just One Drop, which is a documentary about homeopathy, which is amazing. And I got a chance to see it recently because I got a private screening of it so that I can talk about it tonight and be with all of you about it. But I'm so honored to have all of you here. So that was a long sentence, and welcome everyone.
Thank you. Thanks, Amy.
Oh, so good to have you all.
Amy, Shari.
What? Thanks, Amy. Oh, thanks, Amy and Shari. Yes. Okay. So, first of all, this is episode 131. So we always like to count out how many episodes this is. We've been here on the internet live since 2009, and we've just been doing these amazing shows. And we always try to bring topics that you may not know about. Some of it you may know, some of it you may not. And hopefully tonight you will learn something. I know you will, and you will gain some knowledge of how you can, some alternative ways that you can really treat your family and yourself. So yes, and people are saying they're so excited to see the film. I had a bunch of people message me, Laurel, I wanted you to know that, saying that they're going to a screening, that they're going to be seeing the film coming up, and they were excited to be here with us tonight. So, and I see them here in the audience. So let's talk about that for a few minutes. I want to, before we get into like the general conversation of homeopathy, I want to talk a little bit about the film as far as like where it's going to be screened and where it's going to be shown, and it's just coming out now, right?
Well, it first got released. The very first screening was last April 2017.
Okay.
We have in honor of Homeopathy Awareness Week, and we had our screening, our launch screening in the UK.
Oh, fantastic. And so it's been screening all over the world.
Yes.
It's moving across the world. I mean, I know Rachel was moving across the world to come here and do this. The film too, but Rachel and the film moved across the world to come do the screening. Okay, why don't we do this? Let's talk a little bit about homeopathy, and we'll get back to why we did the film, because I think when we discuss what it is and what are some of the reasons that it needs more awareness, we'll understand more of Laurel's commitment to making a film to bring more awareness about this topic. So why don't you start with just telling us a little bit about yourself, Amy, and your practice, and a little bit about homeopathy.
Well, I am, as Shari said, a board-certified homeopath. I've been a homeopath for 20 years now, and I'm also a registered nurse. I run a wellness center in Morristown, New Jersey, called the Remedies Center. I work there with children, babies, pregnant moms, adults of all ages, and families, and it is the great passion of my life to do this work.
Yeah. Fantastic. And I could tell you that when I had my midwifery practice, and for years, I would refer so many patients to Amy for things that couldn't really be treated because moms are pregnant or they're breastfeeding. But even if they could, there's just things that you wouldn't think of that you can treat with homeopathy that work so well and so gently.
Yeah.
So it was really such a blessing to have Amy close by where I can do those referrals, and I still do.
Mm-hmm.
So, Rachel, why don't you, I know you and Amy have been friends for a long time. Why don't you talk a little bit about that and what you do in the UK?
It's a really special night for me because Amy and I trained together as homeopaths in London. So we both qualified together 20 years ago this summer just gone, which I cannot believe 20 years has gone by. It's amazing. And this is a reunion for us. So on a personal level, it's very, very special. And what I love is that all the people I've met through being a homeopath who are involved in this field are so passionate about it that never leaves you. So to come together again because of work is actually particularly special for me. And I'm one of those people who, when I first came across homeopathy, when I was a student at university, I thought it was a load of rubbish, to be honest. I thought it was absolutely ridiculous, it's impossible. I was a biology. I didn't know if I'm allowed to say bollocks in America. How rude is that here? But I did say it's a load of bollocks. You remember this? And in fact, I said they should all be banned. It's a load of rubbish. It's bollocks. They should all be banned. So that was a very strong position to take as a 21-year-old. And of course, I cringe now when I look back at that arrogant little science student in my lab. But that was honestly my point of view. And I went all the way from being a biologist, physiologist, neuroscientist, all the way through to eventually training as a homeopath. So that was quite a shift. And never regretted it for 1 second. It's been a fantastic career so far.
Yeah. And now you're doing research. Tell us a little bit about the Institute.
Absolutely, because I was in practice, like Amy, with quite a broad practice for about 12 years, mostly in London, in the UK. And then I just reached this point where, if you like, the sort of scientist in me came back. So even though I'd really enjoyed treating patients, and I loved seeing it work every day, that was so satisfying. There was that bit of me that still wanted to know how it works and still wanted to have trials. I wanted to demonstrate scientifically what I could see in front of my eyes. So I got interested in looking at what research had been done on homeopathy and realized that there was far more than I thought there would be. I didn't think there'd be much at all. There was some really good evidence, but we needed a lot more. And then I met a physicist called Alex Tournier, who Laurel knows very well because he features also in the film. And Alex founded this charity, the Homeopathy Research Institute, specifically to do high-quality research in homeopathy. And when the two of us met, it was one of those amazing things that we just realized in moments that we had the same vision. Very different skill sets. He's quite a quirky physicist. I don't want to be mean, but you know, geniuses are strange people. I'm the kind of slightly more normal scientist and homeopath, and between us we had the skill set to put together this charity, and that's been quite a ride. I've been working for HRI now for 6 years, and we communicate about research, and we also do trials. So at the moment we've got trials running on ADHD in children, and depression, irritable bowel syndrome, and then the really exciting project. We are literally about to open a research laboratory in Heidelberg, Germany, which is where we're going to do pure physics experiments on water and hopefully find out how the pills work. It's about time.
Wow, wonderful, so wonderful.
In existence longer than 5 years.
I've worked for HRI for 6 years. I have.
I interviewed, I thought, in
2011. Oh, yeah. I was part-time then.
Oh,
I don't count that.
So, Laurel, I just want to turn to you for a moment. So you made a film about homeopathy. You're not a homeopath, right?
No.
Not a homeopath, but obviously this was something that you were passionate about. What inspired you to make the film?
Well, very much like Rachel, I was in the camp of homeopathy is bunk. I'm one of the few people in America that actually knew what homeopathy was, because I wrote a paper about it when I was 17. And I grew up and I was in the medical world, the Boston medical world, which is kind of the center of the medical community in the United States, and one of the leaders. And I was very influenced by that mindset, and I really thought homeopathy was bunk. And I have a chronic condition, and conventional medicine didn't know what to do with me. So I went to see an MD homeopath in Los Angeles, and at that point it was the end of the road for me, and I was feeling rather desperate. And I always am very clear to say that it's not that I had a miraculous cure and that's why I want to make the film. That was not the motivation. The motivation was, first of all, he was talking about his work with autism. And back then, this was 9 years ago, and nobody knew quite what to do with autism, and in fact, they still don't. But he said to me, you get better to make a film about this. And I remember then, months later saying, tell me what you had in mind. And he was talking to me about how he treats autism. And he said, why don't I send you some chapters of the book that I'm writing? And he sent me the chapters. And that was the moment when I went, oh my God, there's a totally different way of looking at health and healing. Mm-hmm. And so that was really, it wasn't that I had a passion about homeopathy when I started. I was curious. And I went, boy, it totally was like a 180-degree turn for me. It's like, there's another way to look at health and healing. So that's what I always say was the spark, but the flame that kept me going for 8 years, 8 long years, was hearing story after story of people who's telling me that homeopathy had changed their life. Yeah. And at the same time, I know that there are many people suffering. Yeah. And the information was not getting out there. And if it was out there, it was skewed. And what I always say is, for me, this is not just a film about homeopathy, but it's a film about freedom of choice in healthcare.
Yes, absolutely.
So that's why I made the film.
So if I can jump in for a second about when Laurel and I met, it was back in 2011. And I remember, because it was the first time I'd ever been interviewed in my life, and I had no idea what I was doing. And Laurel said to me, just so you know before we start, I don't really think homeopathy works. I said, okay, that's fine, I'm used to that.
Did I say that?
Yeah, you said that to me. And she said, but I'll be fair to you, so I won't screw you over. To use your exact words. You did really to me. You did.
You heard it.
I remember it very well. So I was thinking, if someone says that, does that mean they're more or less likely to actually screw you over? I was trying to decide whether to trust her. But I did trust her. And she said, look, I don't personally think it works, but I think there's a story here. I think this is fascinating. There's two sides to this. Some people think it's amazing. Some people say there's nothing in it. So I want to make this film. And I do remember saying, you're the perfect person to make this film then, because I don't want a homeopath who loves this already to make this film. I want somebody to challenge it and show both sides. And that's what Laurel has done so well. And I think it's because she started at that point at the beginning. And that you really see that come through in the film. It's truly a balanced film. And because most of my life has been spent trying to get accurate information about homeopathy out there, this is just so lovely to see. It shows both sides, but it's accurate.
Yeah, it sure does. And you know, we wanted to play the trailer for you. I apologize to everyone. Technology wasn't working, but Joe's going to go ahead and post the link to Just One Drop right here in the chat. It's justonedrop.film.com. And the trailer is there on the page. I want all of you to go ahead and don't go now, but after the show's over, go ahead and click over and watch the trailer. The film is great, and the trailer is great too. You get a little bit of an idea of what the film's about. But if you're not familiar with homeopathy, definitely want to take everybody through a little bit of the history and a little bit of what it is. Maybe, Rachel, you could start, or Laurel, you could start with a little bit of the history of homeopathy, just briefly. It was so well done in the film. It was so interesting for me, someone who's used homeopathy for 20 years, but to really understand like just how long this has been around, and the genius of Samuel Hahnemann to like even great. It's almost like it was just gifted, you know. That was the feeling I got when I was listening to it. But maybe one of you can explain a little more.
Well, one thing also that people, you know, as a storyteller and as a filmmaker, I had to try to find what's the story in homeopathy, you know, because there could be 110 stories. But to tell the history, you have to find the real heart, like what motivated Samuel Hahnemann to make, you know, to start researching and finding something else. And I found out about the story, which I won't do a spoiler in terms of why he was so driven to try to find another way to cure people.
And this was this was 200 years ago.
Over 200 years ago. But it was a personal event that happened to Samuel Hahnemann. That was really like I call it his dark night of the soul, where he just turned to God, and he was a religious man, and just say, there has to be another way.
Yeah. And
that's really one of my favorite moments in the film. And that was what I found in doing the research. Yeah. But one of the things that this is an international audience that's out there listening. The screenings that we're doing right now, that also Rachel's here for, are here in America. So let me just talk briefly about the history in America. Is most people don't know that the United States was one of the world leaders of homeopathy back at the turn of the century. And a lot of the hospitals here were started off as homeopathic hospitals. And people are surprised. There were homeopathic ambulances. There were doctors that were jumping ship from being conventional doctors to becoming homeopaths. And the term allopathy, Samuel Hahnemann invented that. It was a derogatory term. Again, homeopathy means, you know, to translate it from Greek, means similar suffering. It's a loose translation. And allopathy means same. And so that was his derogatory term of other. And people use the allopathy all the time. So there's all those little nuggets that you learn from the.
Just amazing. Let's talk a little bit about what homeopathy is, because I know that even when I'm watching some of the questions, and listen guys, I see you in the chat room here, and I know they're asking questions about teething, about runny noses, and they're thinking about their babies and what can we use. And what I want to say about that is we may not be able to get to specific questions tonight about how to treat your particular ailment with this, but everything you're posting here are things that can be treated with homeopathy in a very, very safe way. So we're going to definitely do some follow-up on this and do a little reading. I want everybody to, if you don't know much about homeopathy, I really want them to go read, because it's so interesting. People think it's herbal, or they think it's when they think holistic. I mean, there's like words, there's like these buzzwords that.
I do homeopathy. I take echinacea.
Yeah, exactly. And so when we talk about homeopathy, it's kind of all lumped together with this natural medicine, but it's a very specific type of medicine, very specific. And I want to discuss that just for a moment so people understand that it's not herbal, although it uses herbs.
Well, exactly. It uses plants, but along with many other natural substances, thousands of different substances from nature that we use to make into homeopathic remedies, including plants. But often, you know, people use the term homeopathy as a general term to mean anything natural, your essential oils, your herbs, your vitamins, but really it's a very specific science, which is based on the law of similars. And the law of similars is a natural law that states that a substance that has the potential to cause symptoms also has the potential to cure them in very, very minute doses. And so it's a very complete system of medicine that's gentle. It works. It works, and
and one of the things that I always see about homeopathy is that, just like you both said earlier, people are very skeptical because it's so completely different than what we see in traditional medicine. It's like normally when we think of a stronger dose, we're thinking of something that's in greater concentration, where with homeopathy, it actually gets stronger as it gets more dilute. And that's like, it kind of blows people's minds because it's like, well, I'm really not taking anything.
It's a paradox.
And the feeling, I know, even for me sometimes, and I know, and I've used it and it works, and even still, I'm like, is this really good? And then it does.
Everybody has those, yeah. Still to this day.
I just want to tell a story. So today I'm on the phone. Laurel and I jumped on earlier, and right when she called me, my daughter had some oral surgery yesterday, and I gave her arnica. And a lot of you might know this one because it's a very common remedy, is arnica. And if you don't know arnica, you need to have that in your purse all the time so that you have it available. So of course I had it with me, and I gave her an arnica before the procedure and right after, and then a few more times during the night. And this morning she got up and she said, I feel fine, I'm going to school. So she went to school, and the doctor's office called and said, we want to follow up on Jade. How's she doing? I said, she's fine, she's in school. And they said, what? Really? I said, yeah, she's totally fine. She's not swollen. She has no bruising. She has no pain. She's doing great. And she was shocked. And so the nurse asked me, well, she's a good healer. I said, no, I gave her arnica. She might actually be on tonight because she was writing down all my information to watch the show tonight because she wanted to know what she took. But that's a perfect example. That's a perfect example.
Perfect example. And I always thought I'm doing my job when the people I treat, their doctors are surprised by how well they're doing.
Exactly.
So, you're healing so much faster than normal, or I don't see this all the time, and that's how you know it's working, because you're not the one saying that. It's not even the patient saying that. It's their other attending physicians around them that notice the difference, and they're the best judge because they see those patients all the time. Whatever type of illness this person has, that's their specialty, so they can make that comparison between their normal patient and the one that's also receiving homeopathy, and that's what it's such a pleasure when you hear that time and again.
And we're talking about conditions like, obviously, this is for like bruising and colds and very acute conditions, but this also treats chronic conditions as well.
Well, I would say that that's where homeopathy shines.
Yes.
Is that self-limiting conditions, you're going to get better anyway, but conventional medicine, modern medicine doesn't really know how to treat chronic illnesses. It manages them. Yeah. And that's where homeopathy, I think, really is very, very helpful on top of epidemics as well. Yeah. And those are the two places where I think homeopathy really shines. Yeah. And you both talk about it more than me.
Well, that's it. I mean, personally, I'm not a doctor. I trained as a homeopath straight after my degree. But most of my colleagues in the UK are doctors first, and then they trained as homeopaths as well. And all of them have said the same thing, that it's their frustration with their chronic patients that led them to homeopathy, because they just could not help them. And with homeopathy, they can. And that's what I would see. I think the most rewarding cases I had were long-term cases of asthma and eczema and arthritis, some of these really heavy conditions that were making people's lives a misery. And they were, using steroids or whatever, these drugs they really didn't want to be using. And often by the time they came to me, they weren't even allowed to use anything else. They'd exhausted all the conventional options available to them. So being able to get success with them was just fantastic. And the surprise for them was, oh, you can actually treat it. You mean symptoms actually go away and don't come back? So, well, yeah, what did you? Yeah. Because after a while as a homeopath, you get used to that. You get used to the fact that chronic conditions are treatable and can potentially be cured. Now, nobody uses the word cure lightly because it's a big deal, say cure. But I have seen cured cases, meaning they never came back. They were good for years after treatment. And this is another difference. This isn't about temporarily subduing symptoms like a lot of conventional medicine. This is about removing them because you stop the body from repeating a pattern. And that's fantastic.
Yeah. But the other thing I just want to add about homeopathy is that people go in for one condition, but they don't realize that everything else starts to get better.
Yeah.
And that's one of the places also where homeopathy treats the whole being. And so people go in, they don't even talk about their bad knee that hurts or the fact that they don't sleep at night or whatever it is. And all of a sudden those things go away.
Yeah.
But they really went in there to treat their asthma.
Yes. Yeah.
I'm looking at some of the comments, and it seems like there's a lot of moms out there that do have questions about things like teething, runny noses, coughs, colds that I'm seeing in my practice all week right now because it's the time of year. I just want to explain there that one of the great things about homeopathy is that it's very empowering as a parent because you can learn a lot of remedies on your own, first aid, remedies for acute conditions and first aid problems. It takes some study, but you can research, you can get some books and get a kit or some.
I actually have a kit.
Yeah.
I want to show them. So this right here, this is a kit that is for childbirth and for breastfeeding and postpartum. And then there's different kits, and this is all we have in our home is all the different kits. And which kit is it going to be in? And it does come with a little booklet so that you can read about the remedies. And I always say to people, make sure you read through the book because there are things that you can treat that you wouldn't think that you can treat. That you can't treat with regular medicine.
To make a distinction, there's acute illnesses and then there's chronic illnesses. When it comes to acute illnesses, there are many things you can learn to help your family on your own. When it comes to chronic illness, you really want to find a professional homeopath.
That was one of my questions. Like, homeopathy is very empowering because you can do it on your own. And the more years that you do it, like now, if even myself, I'm not a homeopath, but somebody says, I have this, oh, I think you need hypericum, or I think you need, whatever. And so I'll be able to, I remember the remedies because I've used them a lot. But where's the distinction between when somebody really needs to see, like, why would they come to see you versus just treating themselves?
When it comes to chronic illness, it's important to see a professional because it's, even if you might you might look something up, or even go to the health food store and they might casually recommend something. Here, take this, for your asthma or child's asthma or something like that. Once you take the remedy, even though you may get better, the process of healing can be complicated, and certain things might get better as other things get worse and things change, new symptoms may come up. And as homeopaths, we know how to interpret that and what to do. But on your own, you can become confused and you don't know when to repeat the remedy, when to stop the remedy, all these things. And that's why it's important to really work with a professional when it comes to any chronic illness.
Yeah,
absolutely.
It's really
I would say that there's quite a difference that usually with homeopathy, it's not one pill. You give somebody a remedy and then their symptoms change. And it's the job of a professional homeopath with 3 or 4 years training. We have that training for a reason to learn what to do next. As the symptoms shift, you change your prescription, you adapt what you're doing. You might change the dose, the repetition, what the remedy is made from. These are all things that only a professional can do. But I think, people have common sense. They know when to go to a pharmacy and buy something over the counter with conventional medicine, just as they know when to see their GP, family physician, or their specialist. So it's like that. It's the same kind of judgment call. But I agree with you. I think having those kits, and I've got the green kit that's in my suitcase now, I never go anywhere. But having those kind of kits at home, there is nothing like using it yourself. And making it work to give you a bit of a toe in the water with homeopathy. And then when you want the thorough job doing, you go to a professional.
But I also want to jump in because on tour with the film, I'm asked these questions quite frequently, is that, first of all, you can go to places like Whole Foods. They sell the remedies. You don't have to go to a pharmacy, and you can start experimenting with the different remedies and learn about them. Here in America, you don't necessarily have to buy a kit. You can start really with 1 or 2 single remedies. However, if it doesn't work, it doesn't mean that homeopathy doesn't work.
Absolutely.
And that's the place where people say, I try, it doesn't work. And that's the point where I'll say, go to a homeopath. I also have to say that homeopaths study for decades. True. They might say 3 or 4 years. They study for decades and just to get started. And people ask all the time, how do I know if it's a good homeopath? And that's a hard question to answer. But I can say that homeopaths are the smartest, most dedicated group of people I have ever met. They never stop learning because it's such a huge, vast field to learn. And they're usually very, very well studied. As they say, for decades.
We're only we're just beginning.
Yes. And I also want to say that, some of these questions, what do I give for my son's eczema? That's a really hard question to answer because 10 people with eczema can need 10 different remedies. In homeopathy, it's very specific based on the characteristics of the person and those symptoms of that eczema. So it's not as simple as, oh, you have eczema, try this. And that's why when Laurel says you might try a remedy and it doesn't work, it doesn't mean homeopathy doesn't work. It means that you didn't take the right remedy.
Absolutely. I'm so glad that you brought that up because to me, that is what differentiates homeopathy from every other form of natural medicine or holistic medicine. It's that individualization of each prescription. And there's a reason, again, you see a homeopath for quite a long consultation. It varies. It might be half an hour or an hour, what have you, for a chronic condition. We have to ask you a lot of questions to decide which one of maybe 200 or 300 possible prescriptions we're going to give you for that condition. Yeah. So that's how involved it is in finding the exact pill for the patient in front of us. So I'll get this all the time, even from the hairdresser. Oh, what should I take for my psoriasis? Well, unfortunately, you can't say without taking the case, working out the prescription and saying that's what you should take. So it's that individualization that's key.
Yeah. And for those people that are going to watch my film, in the scene in India, there is one part where you will see these two posters that are on the wall, and it says, "My headache is not like your headache."
Yeah, I love that. I saw that.
Speaking of the film, I was just so amazed. We have a film next week that I'm hosting in New Jersey.
Tell me more. When?
It's going to be on Monday in Morristown at the AMC.
Sold out.
It's sold out. It's sold out weeks in advance. I mean, we have quite a long waiting list. I wish we could get a bigger screening room.
Have to do another
screening. What's that? Yeah.
Maybe you have to seriously.
Yeah, maybe. And so, but I just was amazed. I think the public interest in homeopathy is not just growing, but people are really looking for some other answers out there. People have become disillusioned with what the conventional system has to offer in many respects. So this film has in Morristown anyway, in New Jersey, it's like sold out like that, and I really encourage anyone else to go check out the film because it really provides the information. Homeopathy is complex; it's not that easy to grasp, but there's so much rich history there, and the film really gives you the basics. So,
can I just talk a bit about the distribution? Can I jump on that?
Go ahead.
How much? Well, first of all, when I was making this film, and I've been making films for about 30 years, and I always get some money from grants. Even my film on alien abduction, I got money. And I couldn't get one grant dollar from this. And so all the money solely came from individuals around the world through crowdfunding. And so I knew I had a very strong grassroots movement. And I decided to do this first phase of distribution it's really a grassroots model, and it's where individuals like Amy step forward and say, I want to do a screening. And if you're in America, it's very, very simple. If you go on my website, which is justonedropfilm.com, and you go there and you just say, put your zip code in, and you can actually pick a theater and go live immediately. And all you have to do is get a number of people to buy tickets in advance, and you don't have to pay any money, and you can actually set up your own screening. And we have been screening this all over the world. 90% of the screenings are selling out. Yeah. I mean, it's taken off like wildfire. I think we have 12, it's translated now into 12 different languages. And every day I get another country writing me, can we put this film in your language? And so what I'm realizing from all this, and yes, Amy, that the public is hungry, but I also feel like homeopaths feel that their voice is finally being heard. Yeah. Because I feel, and really my strong passion for finishing this film was feeling that homeopathy has been suppressed and maligned for 200 years. And I feel like that all I really wanted to do was give homeopathy a voice. Yeah. Because the bottom line, I don't really care if people use homeopathy, but I care that they know about it. because I don't want people to suffer. And so that was my impetus to make the film. And that's why I'm so thrilled that people like Amy are taking it and actually doing a screening. And I'm super thrilled that Rachel is here. And the reason why I'm so excited for all you people out there that are going to be at the 3 screenings that Rachel's going to be at, one of them tonight, is that we get so many questions asked about the science. And I'm just beyond thrilled that Rachel is here, and we're actually going to be recording those Q&As so we can make that information available to everybody.
So great.
I shall answer all those questions.
So great. And that was actually somebody posted in the chat room, will there be a Q&A after the screenings? And so you just answered for them. So great.
Yes, and the film was made, the film was really made as a springboard to have discussion.
Mm-hmm. So great.
If
So
you
you started to
about a subject, I feel like I'm pleased when they have questions at the end. I love that. And the more challenging, the better. I shouldn't say that, actually. I'm setting myself up.
You're setting yourself up there.
But really, I do, because, like I said, I remember not believing it. It's the wrong word. I actually, thought it was a terrible idea at one point. So when people say to me, oh, I really think it doesn't work, I'm really interested in why they think that, where they've got that from, what they know about it. And usually I find out that the people who say it doesn't work, who call themselves skeptics, don't actually know very much about it at all. Yeah. They've never tried it. They've never read a book on it. They've certainly never read a journal article or any research on it. So they're basing that opinion on very, very little. And it's quite interesting once you talk to them about that, say, well, what do you really know? What do you really know?
Right.
But
that brings up I just wanted to ask a little bit about the controversy, because there is so much, and you would think with something that is so helpful and has healed so many people and has worked for and survived 200 years, and why is there so much controversy? And I know this was, without giving a lot away of the film, but this was a big part of the film that you were involved in there, Rachel, was the report the Australian report. And can you tell us a little bit about some of the controversy and why? I know even when I bring it up, and even like just doing the show tonight, there'll be people who are almost angry over the fact that we're even discussing this, which doesn't matter to me. I don't really care. They don't have to watch.
You do grow a thicker skin, and you have to, because really, day in, day out, I'm abused, personally attacked and abused on a daily basis, purely because of my job. And that's quite shocking, really, especially because I am a scientist, and I do believe in evidence, and I do believe in accuracy and discussion and open debate and all these things. I'm not a wacko, I'm not a hippie, I'm not even a vegetarian. And I do, my God, I had a hangover. I was, Rachel, there's bits in the film where I've got short hair. I had the worst hangover in years because after a huge party. So, I am pretty normal. So, it shocks me that I've had people literally say to me that, I've been getting on very well with them for some time, and then they find out what I do. And one woman actually said, I'm sorry, I can't talk to you anymore. I was like, okay. She said, I'm a biochemist. And I was thinking, wow, oh, well, in that case, so it's strange that this complete myth that if you know about science, you cannot think homeopathy works. And that is a complete myth. We do have to remind people it was invented by a doctor. It's practiced mostly by doctors. It's researched by experts in universities all over the world doing pure research. So this is science, whether you like it or not. But the reason for the controversy, it's quite strange. I think it's almost because it's too good to be true. It's like people find it so hard to believe, because I remember this feeling once, saying you can't be serious that it's really this good. It can really treat acute conditions, chronic conditions, infections, serious skin conditions, but it's safe and it hardly has any side effects. And it's cheap. And it's cheap. And babies can take it, and pregnant women can take it.
And it's
like,
curative.
It's too much. We just can't handle it, because we've all been brought up with conventional medicine, which, God, we wouldn't be without, would we? It's fabulous when it works. Conventional medicine, thank God for it. So, that's what we're used to, but we're used to it coming at a price. We're used to, there's always some side effects, or you better be careful with this drug if you've had this history, or you mustn't mix these drugs together. So there's all this caution we have got used to with medicine. So to come across a medicine that is so good, it's almost too much for people to take on board.
Yeah, that's so true. It's so true. And because we can't fully understand exactly how it works, and that is a piece of it.
You're right.
It's like if we can't understand it exactly, then therefore it doesn't work, which is that doesn't equate. There are a lot of things that we don't know exactly how it happens, but we know that it happens. And and this is just one of those things. So
Well, Amy was one of the people who knew me at college when I really struggled with that. I don't know if you remember. I was a bit of a nightmare in class. I was really struggling, really.
I do remember.
Not get my head around it. And I kept wanting proof, and I kept thinking, but how does it work? And nobody could tell me, and I was so frustrated.
So that's why you're doing this job now, because you're going to find out for us.
well, and I think that when you meet anyone, and I'm going to just say this, when you meet anyone who believes and uses homeopathy, like I'll say for myself, probably for all of you, it's only through experience of seeing it work over and over and over again when you didn't think it would, or you didn't think it could, or you didn't think it was possible, or it must have been a coincidence, but how could it be a coincidence over and over again? Or it must have been mind over matter, but I just gave it to a 3-month-old and they didn't know. So, or a dog, you know, or a pet.
Or a plant.
Yeah, like that's not their mind thinking they got better. And so I know that's been a big thing for me, because I know when Amy first studied homeopathy 20 years ago, I was a nurse, I was a midwife, I was using, and although I was into more natural methods, homeopathy was really, really foreign to me. And it was only through seeing such success, you can't deny it.
I had to see it work in a cat before I believe it. And then I still thought, okay, maybe. I wasn't completely convinced, but well, maybe, you know, it was like a step at a time with each of these cases. Then it was babies. And then when I realized there was research, as Laurel said, on plants, and they're actually double-blind, randomized controlled trials with wheat seedlings in a lab, and it works on the wheat seedlings and not in the placebo group. You know, those kind of experiments, I was like, okay, someone tell me how that's a placebo effect. Somebody tell me how that's fake, because that's, you know, that's indisputable to me.
So I wanted to add that homeopathy works by stimulating a person's own immune system. So what's really happening is we all have the ability to heal, but sometimes we need the information from that nature can provide to push us in the right direction and heal ourselves. So when we do take a remedy, very often it just feels, oh, I just got better. I just did it all on my own. It feels so natural, which is great. What's that?
Must have been my shampoo.
Yeah, exactly. And does it work 100% of the time? No, nothing works 100%. Is that because we haven't found the right remedy, or there's some block in the way? Perhaps sometimes there's something we're doing that could be blocking our healing. But once you do experience a good remedy that works, even once, I think that you believe it forever, because it is like nothing else.
And that's why I like encouraging people to just try it, whether it is getting a kit or getting some remedies and learning enough just to have a go with it, or seeing homeopathy for the first time and just having an open mind. You know, I don't think we can convince anyone that homeopathy works if they've had a completely different view for years. But all I would say to anyone listening is just think maybe we're not wrong. What if we are right? What if all the hundreds of thousands of doctors who prescribe it are right?
Yeah.
And all the millions of patients, you know, just what if?
Yeah.
I think that's all you have to think is what if, and then, you know, look at it in a new way.
Yeah.
Somebody commented that one of the controversies about homeopathy is in the criticisms that, you know, it's dangerous because people may not be getting the medical care they need if they just use homeopathy. Rachel, do you want to say anything to that?
Absolutely. I understand why people say that, because again, there's another myth put around that you have to choose between conventional medicine and homeopathy, or that homeopaths are anti-conventional medicine. Completely wrong. So any homeopath is trained to know when it's appropriate to use homeopathy and when it's not appropriate, when you have to use conventional care. So all you're having with homeopathy is an additional toolbox. That's how I see it. And I'm very lucky. I feel like I was so lucky to find it in my 20s. So that means for the past 20 years, I've been able to go, okay, actually, I'll see my doctor. Oh, no, I'll see my homeopath. Or one will send me to the other. I just do whichever is most appropriate at the time.
Yeah. You know, and for me, really the ultimate goal is the integration of medicine.
Yeah, absolutely.
And not have separate camps.
Yeah.
Yeah.
And what I love is, I suppose, being lucky enough to use homeopathy. Sometimes it's been for quite serious conditions for myself, but often it's been for something really simple, an ear infection or throat infection or something. And every time I do that, that's a drug I didn't have to take.
Mm-hmm.
So I feel like it just saves my body that stress of pharmaceuticals that I don't need. And then if I really need them for something one day for something else, I have this, nice idea that, okay, for that, I'll take the downside, know?
And what I find by having the remedies available, and the kit's really nice because it just kind of gives you the variety of whatever might come up, especially for me where I'm not a homeopath, and it gives me some instruction, whether it's my children or myself, to kind of read a little bit about it. And one thing about it is that if you take the wrong one, it's not going to harm you. You can still take something else. You can kind of experiment a little bit without feeling too worried about it. But I find that when I take the remedies, I don't need anything. I'll say, oh, let me start with this. Or I'll wake up in the morning and, just that feeling in my throat, like, oh, am I getting sick? Just the thought. It's just starting and I'm getting sick. And I take aconite and I just don't get sick. And I could say, well, maybe I wasn't getting sick, but it's over and over and over again.
I was going to say, is it possible because I do feel like I want to give some answers, so many comments
we can. We have a little bit of time, and I would love that. I mean, if
yeah. Well, just that aconite is a really good remedy because there's a lot of parents out here, and it's this time of year when you can catch a chill and the nose starts running, and if you catch it right away and sort of that first day, a remedy called aconite, ACONITE, which you can get at any Whole Foods or any other local health food store, can really nip it in the bud. It's something, it's the one remedy in my house. My husband, no matter what's wrong with him, he says, I want aconite. Okay.
Our kits are empty of aconite and arnica. I have to keep reordering those too.
So I want to just give a little bit of tips I can come back and do more specific things.
I think we're going to do that because we have questions about eczema for babies, and we have questions about teething, and we have questions, and this is where I think there's some really good advice that we can give to start guiding parents in the right direction of what they can do. But in the meantime, I would say, Laurel offered before that you can just go to a Whole Foods and the remedies are available there. Whether you get a kit or you get the remedies. And the great thing about the internet is there's a lot of information now online about homeopathy to read and to.
Yeah, I don't know. Rachel, what do you think about it? I mean, you have to be careful maybe on the internet.
Well, then let me ask this. Where would somebody go to, like a maternal medical, like how would they understand which remedies to use?
There's a lot of rubbish information out there on homeopathy.
So take that back. Reverse.
Yes.
Reverse. Don't go on the internet is a bad place, except for right here. All this rubbish information,
So I'm not sure what the situation is in the US, obviously correct me Amy, but certainly in the UK it's not that hard to find books that you can buy online and get delivered, home delivered from Amazon or somewhere. Self-prescribing books, and I think that's much safer because again they vary. There might be favorites that we have and there might be some that Amy can recommend in particular for a US audience, but most of them are pretty good and certainly good enough to get you started, and I've seen that with my own family that they, I prescribed them obviously in the early days, and then they just sort of got hooked with, if they couldn't get hold of me because I got too busy, they then bought books and started self-prescribing, and then they really got into it. So I've really enjoyed seeing that, and now seeing my family, like you said, Shari, my brother will say, oh, do you think that person needs belladonna? I was like, oh, listen to you. So people do teach themselves, and I love that.
And it's really fun. When you start to know the remedies and you know what's going to work, it is very fun to use as a form of healing.
Mm-hmm. My daughter, who's in college now, is a freshman. She has her kit, and she tells me, she's like, oh yeah, people come to my room and ask me to remedy them, and I'm like, really? She grew up with it, and she says, yeah, it works, and so it's very empowering for even for young people.
Somebody's asking the question, the remedies sometimes have different strengths, like 30 or 200. How do you know when starting out what if you're taking enough or which remedy, like what strength?
Mm-hmm.
Good question.
Yeah, 30 is a really good basic strength to start with, and for most people, the higher the number, the stronger it is. And generally less is best when it comes to homeopathy. So even if you just take one dose, you can read the bottle and see what a dose is. And if you're feeling better, just stop. You don't have to keep on taking. And then if there's a relapse of symptoms, then you can repeat. So that's a good basic, starting point.
Mm-hmm. What do you think about oscillocostinum?
Yeah, I think it's a great remedy.
Okay, so I didn't know if you're gonna let. So I just think it's a great one for people to have in their flu season to be able. It's I don't even want to attempt to spell it. Joe will put it into the chat room because I'm a terrible speller and I know I'll get it I'll butcher it.
Yeah.
But it's called oscillocostinum and it's great for colds and flus and. Just sort of a preventative, like if you're starting to feel sick.
Similar to aconite, yeah.
Similar to aconite. It's like a blend, right?
And
no, it's not a blend.
It's not a blend? Okay.
No.
I don't know if you know that oscillococcinum is the highest selling flu remedy in France, and that's out of everything, conventional medicine and everything else. It outsells all the pharmaceuticals for flu in France. It's just normal for them.
And it's big on Whole Foods. I think you can get it at CVS here.
Yeah, you could get it at CVS.
It's like everywhere.
I think it's made from like the duck liver or something like that, and we call it the homeopathic chicken soup.
It contains multiple viruses, so that's why it's so good. You don't know what virus it is that's going around.
Gotcha.
Also may well help because it's got multiple viruses in it that it was made from, so it's great.
It's a great one to have in the cabinet. We always make sure we have it around in case we need it. And what about any advice for teething? Because that's a big one for everybody of if we had to think of one thing that they're all kind of going through right now, and I know they're going to start saying thank you.
Well, I mean, chamomilla is the biggest homeopathic remedy for teething. Most, I would say, probably 80% of babies will have improvement on chamomilla. There are some that do a little better, maybe on pulsatilla, but it depends on the symptom picture. But as a general rule, you can't go wrong by starting with chamomilla, which is homeopathic version of chamomile. It's not the same as drinking chamomile tea because it's in homeopathic preparation in the pellets. And you can get it in a 30C or really whatever potency they may have at the store will probably be okay. Anyone want to add something?
And if you're giving remedies to babies, I mean, the remedies, let me show you what it looks like. They're little pellets.
Safe
I don't know
when
if you can
nursing,
see this.
yes.
When I hold this up, little pellets in a vial here, okay? So you're taking these tiny little sugar pellets that are so diluted that you'd say, again, how could this possibly work? But if you're giving them to a baby, you're not going to be giving them the pellets like this, right?
They have
dissolvable.
Yeah, they do have ones that dissolve quicker. They're soft, that they dissolve immediately in the mouth.
Okay.
It maybe after thinking about using chamomilla and other remedies for teething, that you're probably aware that for most homeopaths you're treating a lot of mums, a lot of children, and you don't get to treat so many men. The husbands are the last to come for treatment. They're the most reluctant.
Yes.
And
you're doing a good job if the husband comes in, that you've done a good job.
Exactly. So I've always really enjoyed treating men because they're like the most stubborn. It's like, I don't believe this, I don't believe in this, but my wife makes me come, this sort of thing. But what made me think of it was it happened 3 times that I can remember that a dad came in. I was like, oh, okay, so, what brings you? He said, I saw what that teething stuff did with my baby. It's like, it stopped them crying, it stopped them shrieking, it stopped them throwing things at me. Oh my God, I saw it for myself. So it's one of those instant reactions, sometimes within 5 or 10 minutes. And sometimes for people to just see that in their own child. And I said, well, I'm sure that wasn't because you believed it was going to work.
Right.
No, I thought it was a load of rubbish, but I was desperate. So, that's how fast it can work.
Well, someone's asking, Rebecca in the chat room is asking, is it safe to use while nursing the oscillocostinum? And that is one of the benefits of homeopathy, is that it is safe to use. It's safe to use while nursing. It's also safe to use while pregnant. And, that was for me as a midwife, one of the hardest things is that there's not too much out there that can really help and not harm you in that way. So being able to use these remedies throughout, and whether and even in labor, and working with, and really I would recommend that you use, that you consult a homeopath if you're pregnant, if you're going to use the remedies in labor. You don't want to keep self-prescribing, but it's a great thing that you can use through labor.
I'm also a certified doula and have attended births as a homeopath. And it is amazing. I mean, Shari knows as well, using homeopathy in her births she's attended, that it can really make a huge difference when something is stalling, or, the one well-placed remedy can just turn everything around and just have a beautiful birth. So,
Yeah.
absolutely.
Yeah, absolutely. Even remedies to like turn breaches and do things that are just amazing that you're not going to find something out there that's going to do that. So we won't talk too much more about that, but there is a lot that you can use.
Yeah. And I guess I just want to say that if you do find a remedy that you try and it's not working, you really just want to stop taking that remedy. You don't want to, if you go yourself and you find a remedy for something, let's say you've decided not to heed our advice and you have a chronic illness, and you go and you take a remedy and it doesn't work, and then you just decide, well, I'll keep taking it every day. That's a really bad idea to do, because even though homeopathy is generally safe, like any powerful medicine, we have to respect that. And there, so just to know that if the remedy's not working, you stop and you look for something, another remedy or something else. Yeah, absolutely.
I'm glad you said that, Amy. And I also want to add, as a little pitch, if people want to find a homeopath, there is a place called the National Center for Homeopathy. And here in America and other countries, they have their own websites. But here in America, it's the National Center of Homeopathy. And you can go on there and find a remedy, a homeopath that's in your community.
Yeah, that's great. Thank you for saying that. Joe can post that into the chat room as well. And we can also, anything that you have any more information that may need to go in there, we can post it right into the chat after the show, so that we can answer more questions. One more time, let's just talk about the film. Where are you guys tonight?
Portland, Oregon.
Portland, Oregon. Okay.
We're in Seattle.
Huh?
And then on Monday we're in New Jersey. And then on Monday night I fly to Taiwan.
Oh, wow.
I'm not. She's on her own with that one.
I'm going to Taiwan, and they're bringing me to Taiwan for that. And last week I was in South America. It was in Buenos Aires and São Paulo in Brazil, and in Argentina. And it was translated in both Spanish and Brazilian Portuguese. And Rachel
a few days ago I was in Lisbon, in Portugal.
Yeah. While I was in Brazil, and they also had a Portuguese version. And like that, it's really going all over the world. I was a whole month. I was in Australia touring around with it. And when you see the film, you'll see why Australia was such a big part. There's such a big interest in Australia. So again, if people want to see the film, please go to my website. All the current screenings are listed there on justone-dropfilm.com. Go to incoming screenings and you'll see them all. And if you don't see your community there, go and host your own screening. Amy, what has it been like for you to host a screening?
Oh, it's been a lot of fun. It's been great. I've met a lot of people. There's a lot of people I know that are coming, and there's a lot of people that, half of the list are people I've never met, but they've seen it on Facebook and things, and they signed up. So, it's been a lot of, it's been energizing. Yeah.
Yeah.
And the big night is coming.
Yeah, I know. And everyone who's done a screening has had that experience, and it's really, really satisfying for them.
Yeah.
So, and we're in Boston we're having our encore screening because the first one sold out. So we're doing another one December 14th, and I'll be at that one as well.
So great. So great.
Yeah. And we're just getting started.
Yeah, absolutely. What a great discussion.
Yes. I want to just add one small thing is that, this is consumer education, what we're doing with the film, but the other part of it is education in the medical institutions. And that's also part of the dream for me in distribution, is getting the institutions to actually see the film and thinking about health and healing differently.
Yeah, absolutely. I forgot there was a prize for tonight, and they always want to know about the prize. And tonight I sponsored the show myself. So we are going to be giving away, all of you guys have been waiting for my membership to start, and it is about to launch. And tonight we're going to pick a winner, and that winner is going to win a 1-year free membership from me to join us in our private membership group, as well as the video library and all my classes. So if you want to win the prize tonight, which is the 1 free year, you can just comment here. Tell me why you'd like to join, why you need it, what you love about it, what's made you happy seeing these shows for all these years and spending time with us. And make sure you like and love this post, and go ahead and share and tag your friends and share this information, because you never know where you're going to make a huge difference in someone's life that they weren't able to find another way to treat themselves. So you never know how that will help, and spread the word around about the film and the awareness for that, because that, like Laura was saying, it's really, really important that we get that out there, not just to families, but also to the medical profession. And that's how we'll do this. So I just want to thank all of you guys for joining us tonight. Thank you so much. And thank you for your hard work, all three of you, for the dedication and the work that you've done all these years. And to Laurel, thank you very, very much for creating such a wonderful film that people can now learn and share. And what a great thing.
Thank you, and thank you for having us.
Yeah, my pleasure. My pleasure.
Great to see you.
Great to see you too. Okay, everybody, we're going to say goodnight for now, and we'll see you soon. We will have our next live stream next week. And thanks for joining us. Love you guys. Mwah. Bye, everyone.
Bye.
Bye. Bye-bye.